Welcome back to Carolina Women. We are now here at Revive Rehab, and I'm joined by Allie Flowers. It's nice to meet you.
Nice to meet you.
Yeah.
Yes.
I know you've talked to Dr. Debbie a lot of times, but
Yes.
this is my first time meeting you, so this is a really exciting thing. When I asked you what you do, it was like, that's a lot.
It's a lot of info.
It's a lot of info. So maybe just, give us a little bit of an overview, and then we can kind of dive into some more specifics.
Yeah. So at Revive Rehab, so Dr. Jen and myself, so we are women's health or pelvic health physical therapists. So a lot of times people ask me, what does that even mean, right?
Yeah.
So basically, we specialize in treating the pelvic floor, which is a group of muscles like any other muscles in the body that are just not talked about. So we're trying to normalize or destigmatize pelvic health, like being afraid to talk about pelvic health. So we do specialize in treating pregnant postpartum women, guiding them through the whole process of pregnancy and helping them heal afterwards, whether that be from abdominal separation, prolapse, leakage, aches and pains, you name it. We're their support system the entire way. Something that we both wish we had when we were pregnant.
Yeah, because you had a really personal experience with this after your first, you said.
Yeah, so I ended up with a lot of difficulty after my first, with abdominal separation and leakage and things, and there really just wasn't a lot of support or guidance. And so Jen and I decided to become that for ourselves and then for the women in this awesome community. Yeah. And then, what happened is that was our mission. And then it's turned into so much more because we don't just treat pregnant postpartum women, as you all know. So we treat women through all ages, perimenopause, menopause. As we get older, our pelvic floor muscles can become dysfunctional. That can contribute to urinary frequency, like always having to go to the bathroom, constipation, sexual dysfunction, leakage, you name it.
Yeah, so we kind of get, a double bonus there, right? Because when we go through the pregnancy, all that kind of stuff happens to us. And then maybe we get that working again. And then when we get older, we get to just go right back around to it.
Yeah, it's great being a woman.
All kinds of fun things to look forward to. But you, as you said, you really kind of treat the whole thing. So you've got, I know in your other room, you have some exercise equipment in there that, specifically targets that area. But then what else do you kind of do to help
that's a really great question. So of course we look at the pelvic floor itself, which is nothing to be scared of. It's again, they're muscles just like any other muscles in the body, but we take a full body approach to treatment, and we've talked about that a lot because you have to look at how the spine, the hips, our posture, our breathing, our core function, everything surrounding and in the body influences our pelvic floor function. So if you don't look at the body as a whole, like how does this person move? How is their hip function, their spine function? All these factors play a role. And so if you treat the body as a whole and how it influences the pelvic floor, you'll get the best results.
Well, I think that's really interesting that you say that because I was in a Pilates class once and I was, doing a certain move and the lady said, "Oh, your hips are like way out of balance." And I'm like, oh,
what does that even mean?
What does that even mean? And I didn't know that.
Yeah.
So, that's really important that you're in alignment, I think. And you also talked about, before we started filming, lower back pain.
Mm-hmm. Yes.
So that can be a symptom of the pelvic floor as well, which I had no idea that was the case.
Yeah, so we have some amazing physical therapists in this area and chiropractor colleagues of ours that they actually will send patients our way that, hey, this person has this chronic back issue, this chronic hip pain, tailbone pain. They're not responding to anything that we're doing. Can y'all take a look at them? Because we think it could be the pelvic floor, and we don't do that. And so they'll send them our way, and it turns out the patient actually has some underlying pelvic dysfunction, and then that was the missing piece to the puzzle, and then that helps their back pain or hip pain go away that they might have been struggling with and just not responding to traditional treatments. So it's really neat to be able to offer that to the community as a, hey, let's try this. You've tried everything else.
Right. I think that's fascinating. So much of it stems from there. And you just, like you said, maybe it's a little bit uncomfortable to talk about, but also I think it's like you just don't think about it because it's not, your bicep is right here, your calf is right here, but it's kind of all hidden and you just don't really think about it.
And usually it's automatic until something goes wrong.
Right.
And so just anatomy-wise, based on where the muscles attach, they attach to the hips and the pubic bone and everything's connected. But usually these are functions that are automatic. You don't usually have to think about your bowel or your bladder function until something goes wrong.
Right, and then you really have to.
So we're trying to lean more towards let's prevent these issues for our patients.
Exactly.
So,
well, I think it's really fascinating and what a wonderful service you're providing. So thank you for sharing with us today.
Thank you. It's nice to meet you.
Nice to meet you, Allie. And thank you for being with us. And there's more to come, so stay with us.